Although the revenue number for March will not be out until later this afternoon, the preliminary numbers indicate that we will at least hit the March estimate and may actually exceed it. So there are some bright spots out there. Despite that, we continue to face significant challenges, though, because revenue collection historically lags behind the economic recovery. And we've certainly seen that in Kansas. The result has been hundreds of millions of dollars in cuts, significant impacts to our grade schools, our junior highs, our high schools, our universities, our Medicaid recipients, where we've had to reduce reimbursement, which has resulted in a declining quality of care from doctors, hospitals, and nursing homes to the elderly and disabled. So we're continuing to see some progress, but we face significant challenges. The second point that I want to make is that I think it's quite clear from the first part of the legislative session that the consensus appears to be that we can't cut these programs anymore. When I delivered the State of the State almost 3 months ago, I talked about how after almost $1 billion in cuts, I had studied the state budgets very thoroughly, and I didn't see any areas where we could responsibly cut. The consensus that I believe that has developed among the legislators is to agree with that, that to reluctantly agree that despite looking at these areas for 3 months, there just isn't any other area that we can cut. And so legislators that are traditionally considered as conservative have confided in me, and some have spoken openly about the fact that we simply cannot cut anymore. There are really at this point 2 competing budgets out there. The first is the budget proposal that I set out in the State of the State that's been modified to some degree by the Senate. And the second budget proposal is what I would call the Yoder budget that is in the House. The Yoder budget, which really hasn't seen any level of progress, would result in cutting school spending in every school district in the state, and at the same time potentially leading to property tax increases in every district in the state. That budget hasn't gone anywhere. I don't believe that it has the votes to go anywhere, and I do believe that there is a consensus in the legislature that we just can't cut anymore. The third point that I want to make is that the solution is not incredibly painful. The solution that I outlined in the State of the State, I think, is still a very good one. For a relatively modest amount of money, we can stabilize our spending on critical state programs without wrecking the economy. It makes complete sense to me that we would raise our tobacco tax to the national average. Why would we want to have a tobacco tax in Kansas that is lower than what people are paying across the country? And the idea of a temporary 1-cent sales tax continues to make sense to me. We've had a temporary sales tax in Wichita for their new arena, and people in Wichita tell me that it is such a small amount that they didn't notice when it came on and they didn't notice when it went off. We can do that in Kansas, and the rewards will be that we can fund our elementary schools, our junior high, and our high schools. We can fund our universities. We can fund aid to the elderly and disabled. And as we work our way out of the recession, within a few years, we won't need that additional sales tax money. We can repeal most of it, but retain a small part for a new highway plan. It's a plan that made sense to me 3 months ago, and it continues to make sense to me now. 2 final comments about the legislature, and then I'll open it up for questions. First, I want to congratulate the legislature on a couple of initiatives that it's passed. The first being the public smoking ban, and I've talked at length about that, but it was something that we tried to pass for many years, and the legislature did it in a bipartisan way, not only giving Kansas a public smoking ban, but giving us one of the most comprehensive public smoking bans in the country. And then late last night and into the early hours this morning, the legislature adopted legislation that will lead to a path for autism treatment being covered by Kansas health insurance plans. There are many children in this state that are afflicted with autism. Taking care of them is very difficult for their family members, and I'm glad to see that the legislature had to recognize this and put us on a path towards covering this process in our health insurance plans. The final comment that I want to make about the legislature is that I do believe that we can still finish this session in a responsible manner and in a reasonable amount of time. I know that it's unprecedented for us to be at this point in the session and not have a budget, but these are unprecedented fiscal times. And I believe that it would have been quite difficult for the legislature to pass a budget prior to the consensus revenue estimate that we'll be getting on April 16th. The fact that we've been unable to pass a budget up till now doesn't mean that we can't create a responsible and timely plan when the legislature does come back. We have plenty of time available, and if people will not play party politics, not worry too much about the elections coming up in November, but instead just worry about what the right things are to do for the state of Kansas, I'm still optimistic that we can conclude this session on time during the veto session.